It's Patrik Hutzel from IntensiveCareHome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home, otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium, home IV magnesium infusions, as well as home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, and we also provide palliative care at home. We're also sending our critical care nurses into the home for emergency department bypass services to keep ED beds empty. We have done so successfully in the past for the Western Sydney Local Area Health District, their In Touch service. Today, I actually want to talk more about the importance of emergency department bypass services. As much as we keep intensive care beds empty, I do want to focus more on the advantages of using our critical care nurses also for emergency department bypass services. So today, really, I'm talking to anyone that wants to avoid ED admissions, whether that's patients, families, but also emergency departments, whether it's doctors in ED, nurses in ED, hospital executives. So here are the cost savings, quite frankly. Whenever we can provide an emergency department bypass service and avoid an ED admission for things such as PICC tube changes, PICC tube blockages, where we can unblock PICC tubes, for example, in residential aged care, or change nasogastric tubes at home, or unblock nasogastric tubes, change an IDC at home, or an SPC at home, change a tracheostomy at home, change a cast at home, right? Or make an assessment at home, a respiratory assessment at home, take bloods at home, right? Whatever the case may be, we're saving roughly $2,000, right? Because we're saving costs for the ambulance, right? We are saving occupying an ED bed, right? We're saving a hospital bed after ED, right? So it's, once again, it's win-win-win all around, right? So similar to an ICU bed, we are saving the healthcare system millions of dollars. Plus, where would a patient want to be treated? In their home or in a crowded ED that's full of bacteria, full of infections, right? In a hospital that's bursting at the seams, right? No ICU beds available, no ward beds available, no staff available. Think about that, right? It is an absolute no-brainer to provide this treatment at home. Also, shout out to our friends from Mobile Radiology. We can do x-rays at home. They have been very supportive with our emergency department bypass services. For example, if we change a nasogastric tube at home, they come around and do a post nasogastric tube insertion chest x-ray to confirm the position, right? Again, all the resources are there, right? So the community has come a long way to rally together. Community healthcare services have come a long way to rally together and provide the infrastructure to keep clients out of ICU as well as out of the emergency department. So think about it. Do you want us to help you save $2,000 in ED per admission, right? Because we've done the economics, we've confirmed that with hospitals that we can roughly save $2,000 per ED admission by sending our critical care nurses into the home and avoid hospital readmissions. I think that's a strong enough sales pitch for today. It's a strong enough pitch to keep creating the win-win situations, and I don't want to go any further than that. If you're a hospital executive watching this, reach out to us at IntensiveCareHome.com, call us on one of the numbers on the top of our website, or send us an email to info@IntensiveCareHome.com. If you are an ED consultant, ED medical director, ED nurse manager, or any other hospital executive that can see value in what we're doing, and you want the same service for your emergency department, reach out to us at IntensiveCareHome.com. With Intensive Care at Home, currently we're operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS-approved service provider, TAC in Victoria, WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, and DVA all around the country. Our clients also receive funding through public hospitals, private health funds, as well as departments of health. We are the only provider in Australia in 2024 that has achieved third-party accreditation for intensive care at home nursing. No other service provider has achieved a higher level of accreditation in this field in the community. We are therefore in a position to employ hundreds of years of intensive care and critical care nursing experience combined in the community. And I believe that once again is unmatched in 2024 in Australia. No other provider brings this high level of skill into the community, and no other provider in Australia can look after a higher acuity in the community. We're the only service in 2024 in Australia that has achieved third-party accreditation for intensive care at home nursing. And if you are at home already and you realize you don't have enough support or you don't have enough funding, whatever setup you have isn't working for you, or if you're stuck in ICU, you're constantly going back to a hospital, or you are in a hospital already in an ICU long-term, that, please reach out to us, including if you need more funding for NDIS or any other funding body. We provide NDIS level 2 and level 3 NDIS support coordination. We're also providing TAC case management. Like I said, we are providing level 2 and level 3 NDIS support coordination and TAC case management. And we can help you and your family to get onto the NDIS. We have an NDIS support coordinator and TAC case manager, Amanda Riches, and I've done an interview with her that I'll link towards below this video. And if you are an NDIS support coordinator watching this and you're looking for nursing care for your participants, especially when it comes to the things that I mentioned in the beginning, ventilation, tracheostomy, BIPAP, CPAP ventilation, home TPN, etc., please reach out to us as well. Or if you are looking for funding for more nursing care as an NDIS support coordinator and you don't know how to advocate for it, please reach out to us. We're also providing NDIS specialist nursing assessments done by critical care nurses with a legal nurse consultant background. And if you are a critical care nurse and you're looking for a career change, you might have come to the right place. We're currently offering jobs for critical care nurses with a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification in Melbourne, Sydney, Brisbane, Albury, Wodonga, Bendigo, Warragul, and also in Geelong. And because we are offering a tailor-made solution for our clients and their families, which includes regular staff on regular teams, our clients want the same staff coming over and over again because they are very vulnerable. It's all about building critical relationships and having regular staff on stable teams. This also means if you are potentially looking for agency work and you want to come and go, this may not be the right fit for you because we're looking to engage with you on a long-term basis, and our clients want to engage with you on a long-term basis. So it's all about building these critical relationships long-term so that it remains a win-win situation for everyone. And if you are an intensive care specialist or ED specialist, we also want to hear from you. We are currently expanding our medical team. We can help you eliminate your bed blocks in ICU and ED for your long-term patients or for your patients that come in regularly. We're here to help you take the pressure off your ICU and ED beds. And in most cases, you won't even pay for it. But even if you do pay for it, it'll be much more cost effective than the actual ICU bed. If you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, please reach out to us as well. Lastly, if you're in the US or in the UK, we can help you there privately if you need help. Once again, contact us at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my YouTube channel or if you are a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.